Good afternoon. I am Debbie McKeever, founder and owner of Strong and Healthy Temple, a virtual holistic health and wellness coaching practice servicing clients worldwide where we focus on bringing balance to the mind, body, and soul. And today I wanted to talk with you about body dysmorphia. Body dysmorphic disorder, it's a mental illness whereabout an individual is obsessively focused on what they believe to be a flaw in their appearance. And the perceived flaw is usually either minor or completely imagined. Again, it is a mental disorder, not to be confused with inferiority complex, where you may just look bloated in an outfit or something like that, or you may actually be retaining excess water that day or whatever. I think we all have a little touch of inferiority complex every now and then, so it's not to be confused with the actual mental disorder. One of the signs, some of the symptoms of the disorder are a person who, they may be obsessed with like cosmetic surgery. They may be overly obsessed with exercising or dieting. They are constantly checking their appearance in the mirror. And I'm not just talking about vanity. I'm talking about just a constant unhealthy check. And I see it a lot in the gym. And I want to make it clear that it's not just women, but also men. And I think it probably is more prevalent from what I've seen among men. I think that, like with anorexia and bulimia, men are more so in hiding when it comes to things like that, when it comes to anorexia, when it comes to bulimia, when it comes to body dysmorphia. I think women are a little bit more open about it. Men aren't as expressive as women anyways. I think women are just more expressive and emotional creatures in the first place, and I think men are just more embarrassed by it, and so they tend to hide it more. And like I said, I see it a lot in the gym. Initially I kind of even saw it as vanity, but then I kind of started to recognize the signs, like the constant mirror checking, and notice that it wasn't just vanity, like constantly checking their waistlines and things like that after a specific exercise, or do a chest exercise and then already thinking that there's going to be some type of change in their chest, or doing an ab exercise and thinking there's going to be immediate change in their abs. Or I've seen guys come in and weigh themselves when they come in, do some exercises, maybe some cardio and some weight training, check their weight again, and then do some more exercising, check their weight on the way out. And I think I was just kind of surprised to see it more among men. And then, like I said, the constant mirror checking. So having that dysmorphia where they feel like their body is flawed as far as their physical, as far as their physique. And there are also, like I mentioned, with the cosmetic surgery, there might be people who may be obsessed, thinking my nose is too big or too wide, or my lips are too thin or too thick, or whatever the issue is, whatever you perceive the issue to be. It is in fact a mental disorder. And people like that generally will avoid like photo ops. They'll avoid social gatherings and things like that. Like, they don't really want to be seen. And not to be confused with being an empath, or being an introvert, or if you have a pimple pop up on your face right before an important event and you're freaked out about it, that doesn't mean that you have body dysmorphia. Again, this is like obsessive behavior that is constant. And so these people are spending like hours per day trying to fix what they believe this problem to be. So again, it's not about vanity or anything like that. It's just that they really perceive that something is wrong with them, whether it be like the way that they're shaped, the way that they look, their hair, whatever it is. They're constantly trying to fix this perceived problem, and there's different levels of severity. So depending on how severe the dysmorphia is, it determines the level of help that you need. Like some people may be able just to hire somebody like myself, hire a life coach or a fitness coach or whatever to help, and there may be some people that require other levels of therapy, and then it may be so severe that they may even require a psychiatrist or even medical intervention. And as always, I want to keep this video brief. I may do a little bit more discussion on body dysmorphia. I'm not sure if I want to, make a series out of this or just, discuss other topics regarding appearance, but I just wanted to talk very briefly about that. And I just kind of thought about it really the other day when I saw particular individuals that I see in the gym a lot, and these are all males that I'm speaking of, that initially where I thought it was vanity, and I realized that it is actually something a little bit more severe than that. And so sometimes we do have to take our step back and take ourselves out of judgment, because the person could actually have some kind of a mental illness, or mild or severe disorder. So anyway, if you like this video, please give it a thumbs up. I would love for you to subscribe to the videos, hit the bell notifications, hit the bell icon if you would like to receive notifications once you subscribe. I would love for you to share this video with your network. Thank you again for watching, and make it a great day.